How long does a scar take to heal after having a mole, cyst, or lipoma removed? Right. Okay. Yes. So here you go. Here goes joined. Oops. So basically, broadly speaking, a skin lesion, so mole, cyst, whatever, a skin lesion, broadly speaking, and it depends a little bit on the area, and it depends a little bit on the tension on the wound. But as a ballpark, 5 to 7 days, the skin should be healed. So broadly speaking, 5 to 7 days, the skin's healed. The skin on the face heals a lot more quickly than the skin on the body. So that's why often you'll have stitches on your face and they can come out within 5 to 7 days. But on the body, it often takes longer for it to heal. And also the other thing which will be a factor in how long it takes to heal is the amount of tension on the wound. So if you've had a big mole cut out, then there might be a lot of tension on the wound. Whereas if you've had a lipoma removed, which is underneath the skin, there might be no skin removed whatsoever. So you might just have an incision in the skin and then the lipoma is taken out from underneath the skin. So there's a lot less tension when you have a subcutaneous lesion like a lipoma or a cyst compared to a skin lesion like a mole. So the ones with more tension will take longer to heal, and so the bigger they are, the longer they'll take to heal. And also certain areas, things like the back, the ankle, around the lower leg, the blood supply is not great, so the healing is a bit slower. So if you did have stitches in, we often use dissolvable sutures in order to avoid having stitch marks, which are little dots at either side of the scar. But if you do have kind of normal stitches with on either the scar and like the normal traditional what you'd imagine stitches to look like, those stitches need to be in for longer. So as I say, the face, they can come out in 5 to 7 days, the body 2, maybe 3 weeks, just to make sure the wound's completely healed. And the problem with doing that is it can leave stitch marks if you leave the stitches in for a long time. So you've got to think, oh, do I want stitch marks or do I want a wound that doesn't heal up? Now, what we normally do is we normally use dissolvable sutures subcuticular underneath the skin, so they don't leave stitch marks, and you can leave them long. They stay longer because they're underneath the skin, so they're dissolvable. So that's not normally what we do, but yeah. So the skin's healed in a week or so, but it takes months for it to mature. The scar goes a bit red, a bit active, a bit firm, and it takes. I normally say it starts about 3 months, 6, 12, 18 months for it to fully mature. So it's healed in a week or two. It takes 6 months or so to sort of mature, maybe 12 months to probably mature and soften and settle and go skin colored. That's often red to start off with.